Welcome to today's Explainer. We're diving right into a seriously fascinating, data-driven breakthrough when it comes to dental implant predictability. If you're a clinician and you're looking to accelerate osseointegration and just generally improve your patient outcomes, you're definitely going to want to pay close attention to the data we're about to unpack. Let's get right into it. So our source material today is a peer-reviewed paper. It's titled Miniaturized Electromagnetic Device Abutment Improves Stability of the Dental Implants, and it was published in the Journal of Craniofacial Surgery. Now, what makes this research so compelling to us is how directly it confronts a really stubborn clinical challenge. You know the one, early implant failure, primarily driven by inadequate bone-to-implant contact during that absolutely critical initial healing phase. Right, so it really boils down to this. How can we actually improve predictability and advance preventative dental care against that early implant failure? For decades, standard protocol meant a 2 to 6 month unloading period. We just had to wait. But as we know from the literature, trying to shorten that unloading time without the right support, well, it increases failure rates by 2 or 3 times, especially in unsplinted devices. So the ultimate goal here is to safely reduce that waiting time while still ensuring strong, reliable osseointegration. Enter the MED, or Miniaturized Electromagnetic Device. This is essentially an active healing cap. What it does is deliver localized PEMF, that stands for Pulsed Electromagnetic Field, directly to the implant 24 hours a day. And the brilliant part? Unlike external devices where you're totally relying on the patient actually remembering to use them, this cap is internal. It's continuous. It's using PEMF to directly stimulate bone healing and neovascularization exactly where it's needed most. Okay, so how did they actually test this? Well, the researchers ran a prospective case-controlled series. We're talking 12 patients and 28 implants in total. They placed 12 MED healing caps and compared them against 16 regular control caps. Now, to get an accurate read on success and stability, the team used resonance frequency analysis. This allowed them to track stability from the exact moment of placement straight through those incredibly critical early weeks of healing. All right, take a look at the actual resonance frequency analysis table from the clinical study. At baseline, the numbers for both the control and the MED groups start off statistically similar, hovering around 56 for the mandible and 61 for the maxilla. But watch what happens as we move through day 15, day 30, and day 50. The data clearly shows the MED group just pulling ahead in stability, which is quantified here by the implant stability quotient. Let's actually isolate a couple of these specific, highly significant data points to really see what's going on. Check out the early stability in the maxilla at just 15 days. The control group is sitting at 62.1, but the MED group, it's already climbed to 66.2. And what's absolutely vital to note here is the p-value, 0.0008. That incredibly high statistical significance proves that this localized PEMF stimulation is having an immediate, measurable impact on bone healing right in that highly vulnerable 2-week initial window. It's a real game changer. And here's another standout number from the study, 73.5. That was the exact implant stability quotient for the MED mandibular implants at day 30. Now compare that to the control group, which was lagging behind at just 66.7 at that exact same time point. To put it simply, this number directly represents accelerated biological stability. The osseointegration isn't just happening, it's happening faster and significantly more robustly than it does with standard healing caps. So what does all this data actually mean for you day to day in your practice? Well, the clinical takeaways are pretty hard to ignore. We're seeing superior stability during that early healing phase, and that safely opens the door for faster potential loading times. But honestly, more importantly, this translates to a greatly reduced risk of early failure. It's a massive shift toward proactive, preventative dental care. By utilizing this tech, you're actively encouraging bone growth rather than just placing a standard cap, crossing your fingers, and waiting. If you want to bring this exact level of clinical predictability to your own patients, follow Magdent on Instagram and LinkedIn at Magdent MED and visit magdentmed.com to book a demo. You can also easily scan the QR code on your screen to go directly to their Instagram. Integrating PEMF through an MED healing cap drastically accelerates biological stability. So the question is, why continue leaving your early implant healing to chance? Thanks so much for joining me on this explainer, and keep exploring.